Roger Ellis has been struggling with these symptoms for nearly 4 years. His son says he and others like him deserve answers.
It keeps me going. We have to get to the bottom of this.
In 2021, the New Brunswick government announced it was dealing with a mysterious condition. It investigated 48 cases. Then last February said this.
The committee has concluded that no such syndrome exists.
Now, the Public Health Agency of Canada is sending 2 federal epidemiologists to New Brunswick for 3 days. It says their focus is to help the leading neurologist, Dr. Alier Marreros, with paperwork the province says he's been unable to keep up with. His patients say he's the only one trying to help them.
I hope the support for Dr. Marreros is an unbiased support, and that they also do look into environmental testing because I host support groups for the patients, and there's a lot of things that are quite similar.
The New Brunswick government is clear. This does not mean it is reopening its investigation.
That's unacceptable, and we're still going to continue to demand an investigation.
In January, Dr. Marreros wrote this letter to the Chief Medical Health Officers of Canada and New Brunswick, saying he's now following nearly 150 cases. The number of cases has continued to increase, as well as the number of referrals from other provinces, like Nova Scotia, Alberta, and Quebec, he wrote, asking them to study possible environmental toxins.
The devastation and the trauma is for the patients in this country who are in New Brunswick and outside of the province who are being sidelined because public health officials are choosing, in our view, to scapegoat a doctor.
That advocates group has now sent a letter to Canada's health minister requesting an urgent meeting to address a lack of response by Health Canada to what she calls this extraordinary circumstance. Kayla Hounsell, CBC News, Halifax.